The army ant is placed on the wound and positioned so its jaws clamp tightly on the edges, securing them together.
Ouch, without anesthesia, that could sting a little bit.
Then the ant's body is twisted off, leaving its head and mandibles in place, which acts as a stitch. More are added depending on the size of the wound, and these ant stitches are left in the skin until the edges of the wound stay closed on their own.
I've never heard of this. I would think also there'd be like some type of infection problem with the ants. There's bacteria on their prongs there as they stick in. Not something I would recommend, but if you're in a place where there's lots of ants, you have a cut, and you have no access to health care, I'm not sure if I would try it, but maybe it's done out there where there's no access to any doctors or anything to help you out.
Imagine playing the violin while doctors operate on your brain. Sounds crazy, right? But it's real. A woman had a brain tumor dangerously close to the area that controls hand movement. So during her surgery, doctors woke her up and handed her a violin.
So this is actually a real thing. It's actually called an awake craniotomy and is done in specific instances like this. And the doctors actually might ask her to perform specific tasks to see if they're getting near certain parts of the brain that control this. This is actually a true story. There was a relatively famous violinist. Her name was Dagmar Turner, who underwent this procedure, and it was very successful.
As she played, surgeons carefully removed the tumor without damaging the part of her brain that controls fine motor skills.
Truly amazing.
If you lose your arm, a doctor can surgically place a titanium implant into your remaining bone. The muscles and skin are then carefully adapted around the implant, and the prosthetic is attached.
The technology of this has really come a long way, and it's really amazing. When you flex your muscle a little bit, your bionic arm flexes just like your regular arm would. It's really amazing. And now they also have advanced some pressure sensor technology so that you can actually grip things and could put different pressures on your grip, which are truly amazing.
If you hold your pee for too long, your bladder will start stretching out.
Not a good idea.
Which means you would be able to hold more urine after each hold. But due to this bladder stretching when you go to urine, your bladder will make a habit of holding this urine and your bladder will never be completely emptied.
If you have to do this a couple times, it's fine every once in a while, but if you do this on a constant basis, this can eventually lead to damage to your whole urinary tract system, including the ureters, which are the tubes leading to the bladder, as well as the kidneys.
And due to this habit, your bladder would get infected over time with bacteria. So the best solution for this is never to hold the urine and let the flow flow.
So normally you want to pee maybe every 4 or 5 hours if necessary.
If you fire a bullet at a fake silicone implant, most people think it would stop the bullet from reaching vital organs.
That's never going to stop a bullet. I do a lot of breast augmentation, and although the implants, you can jump on them, you can pounce on them, you can punch and they won't break, you can easily jab a knife right through it very easily.
But implants are made of silicone gel and can only be as big as a volleyball, which is enough to slow the bullet down, but not stop it completely. So if you fire a low caliber round, you'd need about 6 implants in a row to stop it.
Probably even more than that. They're not bulletproof, that's for sure.
Introducing Brain Bridge, the world's first revolutionary concept for a head transplant machine.
Okay, so there is no such thing as a head transplant. Once the spinal cord is cut at the level of the neck, there's no recovery for that. That's death. And also, it's kind of crazy here how they didn't keep the blood supply to these heads. They just kind of have this head here, and another body comes in, and it gets reassembled. So this is pure fiction, pure fantasy. This is never going to happen.
Which uses state-of-the-art robotics and artificial intelligence to conduct complete head and face transplantation procedures, ensuring smooth outcomes and faster recoveries.
This is like movie or fiction. This is not reality. Medical science isn't even close to this. No way.
You took a punch to the face. Nothing. No pain, no reaction. You could break a bone, touch something sharp, and still feel nothing. Sounds like a superpower, right? But it's actually a rare genetic condition that stops your nerves from sending pain signals.
This is actually a rare disease. It's called congenital insensitivity to pain, and there are some variations in different types.
Without pain, you miss the warnings. Cuts, burns, all go unnoticed, and that's what makes it so dangerous. So, is it a gift or a silent curse?
This would be more of a silent curse. It seems that people who have this have reduced lifespans because they can't tell any type of pain. They can't tell if they have an infection. They have unnoticed injuries. Their injuries get worse before they notice them, as well as their infections. They have a delayed diagnosis of medical conditions. They have challenges to temperature regulation because they can't feel if they're hot or cold, so they can have severe frostbite or heat stroke. So overall, they have decreased lifespans and they're challenged in their daily activity. So I would call it more of a problem and a curse.
The doctor carefully inserts the endoscope through your mouth, navigating it down your esophagus and into your stomach.
So the stomach reduction surgery is kind of interesting. It's not done by a plastic surgeon. It's usually done by a specialized gastroenterologist. They originally do a lot of upper endoscopies, which is a look inside, but this is a relatively new procedure, and it's only being done by a few people who specialize in this.
Once inside, they strategically place a series of durable sutures along the stomach's inner wall. These sutures pull the stomach into a narrow tube-like shape, dramatically reducing its size. When you eat, your new smaller stomach will make you feel full sooner, leading to weight loss.
This surgery is very similar to how a gastric sleeve surgery works. You have to go on a life-changing diet where you start eating 6 small meals a day and consult a dietitian.
If you only drank Coke, the high sugar and acid levels would erode your enamel and rot your teeth.
So if you only drank Coke, you'd have a number of problems because this is like a high sugar diet you're doing, which is catastrophic over a period of months and years to your body. It would definitely rot your teeth, no doubt about that, have caries.
You'd have blood sugar spikes and crashes, which signal your brain that it needs more calories, even though you're not actually hungry, so the weight would pile on, while the excess sugar would cause fat buildup in your liver.
So this is true. This would also increase higher risk of having diabetes if you only drink high sugar diets. Obesity can lead to a number of cardiovascular diseases.
The lack of nutrients and too much caffeine would cause dehydration, muscle cramps, and even mess with your heartbeat. High sugar intake also speeds up aging by damaging proteins and DNA over time. So an all-Coke diet will literally shorten your life.
You want to stay away from high sugars as much as possible. Every once in a while you can splurge, but definitely recommended do not follow this method.
Stretch marks happen when the skin stretches or shrinks quickly, like during pregnancy or rapid weight gain. This sudden change causes the collagen and elastin in the skin to break, which results in small tears. As these tears heal, they form scars, what we see as stretch marks.
Unfortunately, there are no cures for stretch marks. There's no creams or lotions or lasers that work. If they do, they work very minimally. They will never take the stretch marks away. The only way stretch marks are sometimes rid of if they're in certain places where you can excise them, sometimes a tummy tuck. But stretch marks on the thighs, arm, legs, there's really, unfortunately, no cure for that.
If you pulled out your finger bone, you could use it to write out your name 40 times. Now, if you pulled out your entire skeleton and formed it into a massive stick, you'd have enough to draw a line all the way across Manhattan.
So I'm not sure how they came out with these numbers. Obviously, bones aren't used to draw very much, so I would not recommend doing this at all. So don't do this, or do not try this at home either.
If you cut off your hand, a small device could be implanted next to your arm bone. Now, this device sends electricity into the wound, which causes your cells to multiply instead of heal. As they do, they change into muscle, bone, and nerve cells. And over the next few years, new tissue would start to grow from the wound, meaning in the future, you might be able to completely regenerate your hand.
This is not really reality yet for humans. You can't really regrow a limb after it's cut off, but this is something being studied, and it might be promising in the future when you bring stem cells and everything else into play. And so right now, this is just not possible.
Have you ever wondered why even a slight injury to your testicles causes you deadly pain? When any part of your body gets injured, the nerves present in that part, send signals to the brain.
So there are a lot of nerves in this. There's the ilioinguinal, the genitofemoral, and pudendal nerves, which innervate this with thousands of nerve endings.
But only we boys know how terrible the pain is in the testicles. Most of our body is made up of bones and muscles which absorb any impact on your body. That's why we feel less pain in this parts.
So there's no bone or muscle protection in this area to help you out. unlike other parts of the body, so it's highly exposed and vulnerable to injury.
But when you injure your testicles, more than 4,000 extremely sensitive nerves send signals to your brain. When the brain receives so many pain signals, you feel extreme pain and you start fainting.
These are primitive survival responses. The body thinks that something has seriously happened. And basically, this has been around from an evolutionary standpoint, so it's believed this sensitivity is actually a protective mechanism to avoid damage to the reproductive organs, which are critical for passing on genes.